symptoms and improve quality of life. When the patient understands his symptoms, he knows how to complain, he knows how to explain for their caregivers in order to give them the right, diagnosis and the right medication as well. Usually, to address chronic diseases, this requires prevention of reaching such chronic disease and early detection before reaching, very advanced stage, and management will be difficult as expected. Public health intervention to reduce morbidity and healthcare cost. What is the impact of chronic disease? Chronic disease negatively impact quality of life, as we mentioned, causing physical and mental health issues. Usually we hear from the relatives of elderly population that they said when the quality of life deteriorated, our parents, they became depressed. They lost, the sense of merit in the life. They all the time they keep wishing to die. That's mean they are reaching a very bad state of depression, and this is what we don't our geriatric people to reach it, because if they reach depression state, they will not be cooperative, they will not look forward for to motivate themselves, and they might not be helpful in improving their management. They strain healthcare system, definitely. They will be a big burden to healthcare system with high cost for treatment and loss of productivity. When the patient becomes, sick or ill, he definitely will be absent from his work. And if the geriatric patient is not working himself, but the attendees, his son, his daughter, his brother, his sister, will be, absent from their work in order to take care of them. And this is caused, a big burden on the system itself. Well-being diminishes due to reduced life expectancy and impaired social engagement. And as we said, this exacerbates the depression status. Addressing this requires prevention, early detection, and integrated care models focusing on patient-centered support. When we work in order to prevent the exacerbation of diabetes status, the hypertensive status, when we do early detection and we start giving the patient the medications that controls their life easily, this will be very helpful in controlling the disease early. When we want to talk specifically about cardiovascular diseases, we know that heart failure, one of those cardiovascular diseases, it's a chronic condition, and usually the patient be diagnosed when he comes complaining of shortness of breath and fatigue. Also, when we see patients with coronary artery disease, usually the most complaint that they complain of is the chest pain. Hypertension, as we know, it's the elevation of blood pressure, and most of the patients, they start asymptomatically with this until they reach a complication. Management of this, first of all, as we mentioned, we have to start with lifestyle changes like diet, exercise, social engagement. Heart failure medication usually includes ACE inhibitors like losartan, candesartan, and all, sorry, not candesartan, losartan and beta blockers. Coronary artery disease management use antiplatelets drug and statin, while hypertension is managed with diuretics and ACE inhibitors as well. Also, coronary artery disease interventions involve angioplasty and bypass surgeries sometimes. The very famous chronic disease among geriatrics is diabetes mellitus, and it's, as all of us know, it's a metabolic disorder, and will recognized by increasing the blood glucose, which is hyperglycemia, and it happens as a result of defect in insulin secretion or insulin action, whereas there is a resistance, or both of them. For type 2 diabetes is the most common form, and usually, this is the dominant form of diabetes, type 2, not type 1, particularly in older adults, and often happens due to insulin resistance, where the bodies or the cells are not responding to insulin. Complication in elderly includes neuropathy, nephropathy, and retinopathy, and increased risk of falls. That most of the old patients, when they have complications of diabetes, they have a neuropathy and they don't sense, any subjects under their feet, and this they might go to, or they might be subjected to risk, kidney failure, and sometimes blindness when there is a retinopathy. Management usually involves diet, as we said, that should be controlled, specifically the carbohydrate and sugar intake. And regular exercise should be commenced to improve insulin sensitivity. Walking, running, even if he walks small steps on daily basis, and definitely taking their medication in the regular and perfect dose at the intended time. Oral hypoglycemics, for example, metformin, improve insulin utilization or insulin sensitivity. But insulin therapy is considered necessary to maintain glycemic control, because as we know, metformin prevents the absorption of carbohydrates or minimize the absorption of carbohydrates, improve the insulin resistance and the neuropathic sensation at the terminals, but still does not induce insulin secretion from beta cells of Langerhans, and sometimes patients need either to take insulin or insulin secretagogues. Regular monitoring and food care are crucial for preventing severe complications. For arthritis and musculoskeletal disorders, usually, or most of geriatric patients, usually they complain of arthritis and musculoskeletal disorders like joint pains, hand ache, and sometimes muscle pain. And this condition usually, as we mentioned, affects joints, bone, muscle, and mostly impact mobility and the quality of life. Definitely when they feel pain on moving their legs, and they prefer, resting state in order not to move. And this, affects negatively their quality of life, especially in older adults. Osteoarthritis involves cartilage damage in joints, and this is considered like advanced case, leading to pain and stiffness, and definitely affect movement and as well quality of life. Rheumatoid arthritis, it's considered an autoimmune disease, usually also causing joint inflammation and sometimes joint damage. Osteoporosis characterized by decreased bone density, increasing fracture potentiality. Management, usually we, in those cases, in this age, we focus on pain relief. Any analgesic, we prefer to give it to them, taking in consideration the gastrointestinal status of the patient and like asthmatic status or any other contraindication for such pills that used to relieve pain. And we have to maintain mobility, like physiotherapy, continuous movement, and enhancing it by the attendees or physiotherapist attending, or by the patient himself, and to walk slowly and carefully in order to prevent falls. For pain management, as we said, analgesic, non-steroidal, anti-inflammatory, and topical treatment like emollients and gels or creams. Physical therapy improves strength, flexibility. Assistive devices like walkers and braces, aid mobility is preferred with some type of patients. Fall prevention strategies include home modifications like grab bars that we usually keep it in the toilets for the older patients, exercise programs to improve balance, and regular vision check. Okay. Respiratory disease. For respiratory diseases, such as chronic obstructive disease, and pulmonary disease like asthma, also deterioration lung function and anything affecting breathing ability, chronic obstructive pulmonary disease, often caused by smoking, especially if the patient used to be a smoker for a long period of time, even if he stopped smoking at the late years, but still the deterioration in the lung tissue has happened, and the patient might complain even after smoking cessation. Chronic obstructive pulmonary disease, which is caused by smoking, can involve chronic bronchitis and emphysema, leading to airflow obstruction and difficulty in taking breath. Asthma, as all of us know, it's a chronic inflammatory condition causing reversible airways obstruction. If the airways are obstructed by the inflammation and the constriction, it can be relieved by taking the rescue inhalers. Symptoms of both include shortness of breath, as we mentioned, wheezing when there is narrowing of the airways. Taking air or breathing air might be associated with wheezing and sometimes coughing. Diagnosis involves pulmonary function tests by spirometry and medical history. Management strategies usually includes taking bronchodilators, as we mentioned, and pulmonary rehabilitation to improve exercise tolerance and oxygen therapy for severe cases when they take some devices and to flow strongly on those devices. This can be like pulmonary rehabilitation. Smoking cessation is very crucial for patients with chronic obstructive pulmonary disease to slow disease progression and reduce symptoms that patient can suffer from. Strategies usually involve counseling for the patient, nicotine replacement therapy as a trial to stop smoking, and medications like bupropion. Effective management usually requires combination of medication, lifestyle, and patient education as well. For neurodegenerative diseases, usually they include Alzheimer, and as we see, most of our population, they complain of Alzheimer, and we can see it significantly with patients who has diabetes, in a big percentage in comparison to other diseases. And in Parkinson's disease, or they are characterized by progressive loss of structure or function of neurons, leading to significant impairment. Alzheimer's disease usually affects cognitive function. The patient cannot recognize his family, his kids, his sons. He might have difficulties in recognizing them. And this is at the beginning, and he might end up with memory loss, impaired judgment, and confusion. Parkinson's disease mainly affects motor control and leading to tremor, rigidity, and bradykinesia. Both diseases can also cause behavioral and physiological changes. Management focus on symptoms control and supportive care. Medication for Alzheimer may temporarily improve cognitive function, while Parkinson's medication aim to manage motor symptoms. Supportive care includes physical therapy, occupational therapy, and speech therapy. Caregiver support is crucial due to significant burden, and these diseases place on families and usually can cause very big burden and may involve counseling and support groups. There is currently no cure for either conditions, only supportive management. For cancer, common cancers in the elderly include prostate, breast, colorectal, and lung cancer. And screening guidelines varies from one disease status to another. For example, for breast cancer, usually we go with regular mammograms. For colorectal cancer, they would go for colonoscopies. Treatment options could involve surgery, chemotherapy, and radiation therapy. depends on the cancer type. Palliative care focus on relieving symptoms and improving quality of life, especially in advanced stages. It addresses physical, emotional, and psychological needs. Definitely, patients with cancer, they need all these type of needs collectively in order to be able to survive. For mental health disorders, usually, or the most significant one is depression. And as we mentioned in the beginning, elderly patients or geriatric patients, usually they complain of depression, loss of interest in the whole life. Also, they might complain of anxiety. You find them that saying that all the night I was awake, I could not sleep. And dementia-related behavioral issues significantly impact the well-being of individuals. If the patient is not oriented around the, ecosystem around him, you can see this impacting his well-being. Screening tools like the geriatric depression scale can help to identify which stage of depression that the patient reached, and accordingly that we can manage this patient. Therapeutic intervention include cognitive behavior therapy to address negative thoughts, patterns, and medication like, medications we mean like antidepressant or anxiolytics to manage the symptoms. Social support and reducing isolation are crucial. Interventions may include social activities, support groups, and other befriending services. The chronic kidney disease, it does not start, with full kidney insufficiency. Usually it starts with a gradual loss of kidney function over time. And usually geriatric patients, they don't feel this from the beginning until there is a significant symptoms that requires patient go to the hospital to check. And especially, elderly patients, they tend to keep fasting most of the day, refusing to drink sufficient amount of water, tending to retain their urine in order to go frequently to the toilet. This might exacerbate the situation of the kidney disease. Risk factors include diabetes, hypertension, and family history, and progression can lead to kidney failure and complication that might end up with, anemia and cardiovascular disease. Management usually includes dietary changes like giving the patient low protein because as the kidney, if the kidney is tired, it does not have the capacity to digest the protein, to eliminate the protein. Low sodium in order not to retain much of water, and then this will be another burden on the kidney. Medication controls blood pressure and cholesterol, dialysis to filter waste products in case the patient reach to kidney failure. And kidney transplant, could be considered last stage. Early detection and management are crucial to slow progression and reduce complication and improve quality of life. Regular monitoring of kidney function is essential for these individuals. Sometimes the patient might present with multiple chronic conditions, and we need to manage those chronic conditions at the same time. And this could happen with, significant challenges, like giving the patient like polypharmacy or complex treatment regimens and increased risk of adverse drug reaction. Sometimes you need to prioritize the care that involve addressing the most pressing health issue first, while considering the overall impact on the individual well-being. In medication management, also consider crucial to minimize polypharmacy. If we can give the patient like a tablet contains combination of medication, this would be better. If we can review the drug from the perspective of drug-drug interaction, this would be also better, which is harmful to the stomach if taken on empty stomach, which requires take it on full stomach, which requires taking it in without food, which requires to avoid certain type of foods. All these things should be considered when dispensing the medication for this type of population. Strategic include regular medication reviews, as we mentioned, simplified dosing schedule, and patient education to promote adherence and reduce complications. Comprehensive geriatric assessment, it's a multidimensional aspect, interdisciplinary, practice, and it is required to determine the medical and physiological and functional capabilities of older adults in order to develop a coordinated and integrated plan to treat them for their long-term disease, also to be followed by a long-term checkup. It involves assessing physical health, like mobility, nutrition, cognitive function of the person, his memory, and how he's oriented to surrounding situation, psychological well-being, his mood status, swinging, is he anxious, and social circumstances. Support network should be surrounding this patient, and his living situation should be reviewed. Tools and techniques include standardized questionnaire, functional assessment, cognitive screening test, and psychological evaluation usually are used for those type of population. When we want to individualize the care in order to put a specific plan for every individual, this involves to tailor the care plan to meet a unique medical, functional, and psychological needs of each patient. Each patient is different individual of the other, and we have to meet the requirement of every individual patient in order to get the optimum care, or to provide the optimum care for this patient. Incorporating patient preferences, and we have to consider the patient preferences, his values and culture consideration while preparing his plan. This will ensure that the care aligns with their beliefs and priorities. Setting realistic and achievable goals promote engagement and adherence. This approach requires effective communication, shared decision making with the patient, with the caregiver, with the physician, with the nurse, and collaborative team involving healthcare professionals, patients, and their families, as we mentioned. When we come to medication management, it's considered a critical step in older adults due to increased risk of polypharmacy. They are taking, more than 7 medication usually, and we are expecting significant drug interaction among those medications, and also how to overcome the adverse effects that the patient might be exposed to when he is taking this medication. The strategies usually include medication reconciliation, which involves reviewing all medication to avoid duplication and interaction, and simplification of the regimen to improve patient adherence. Education of patients and their caregiver and proper medication use, how to use the medication properly, at what time, and what methodology. Potential side effects that the patient might be exposed to, and how to overcome it, and when to seek help if there is something essential. A regular medication review by healthcare professional usually helps to optimize medication and minimize any expected harm. Lifestyle modification, usually healthy lifestyle prevents chronic diseases and supports long-term physical well-being. Patients or older patients, they need to eat more fruits, more vegetables, whole grains, and limit their sugar intake, fat, or processed food. Specifically, those type of patients, usually they complain of constipation. If they took this type of fruits and vegetables, this might improve their constipation status. Regular exercise includes walking, swimming, and strength training for better health. Quitting smoking lowers risk of lung, as we mentioned before, heart, and even vascular system diseases as overall. Overcome barriers like low motivation, physical limits, and negative social influence, because we find that some families, they tend to put the geriatric patient in very segregated room away from his family, his offsprings, and this is not a healthy, practice. Use counseling, education, community support to increase life change success rates. Okay. Self-management education, it involves providing education in disease-specific self-management techniques. For every disease, there is certain, hints has to be educated to the patient. Like patient with diabetes might learn how blood glucose monitoring can happen, how can he do it, insulin administration, how to administer his insulin, and how to manage his diet. Also, individuals with heart failure, they can learn about sodium restriction, about medication adherence, how to adhere their medication, what's the advantage of adhering to the medication, what benefit is expected, how their life will be changed. And they have to recognize the signs of fluid overload, specifically for patients with heart failure. Supporting patient in developing self-management skills includes goal setting, problem solving, decision making, and building self-confidence is very essential. And this can be achieved through individual counseling, talking to every patient standalone, group workshops, and educational materials. Effective self-management education can improve health outcome, reduce healthcare costs, and enhance quality of life. Care coordination, how can we coordinate the care? Care coordination is considered very essential to ensure continuous transition between different healthcare settings, such as hospital, nursing homes, and home care. It involves improving communication collaboration among healthcare providers, including physical nurse and social workers, to deliver integrated and patient-centered care, and even communicating with the family member that is going to take care of this geriatric patient. Utilizing care coordinator to facilitate care transitions. Also, this will help ensuring that patients receive appropriate follow-up care and support. It also can assist with medication management, appointment scheduling, and connecting patient with community resources. Can also reduce hospital readmission, improve patient outcome, and enhance the overall quality of care. Rehabilitation care, it is essential for helping individual maintain or regain function and independence, because every individual feels strongly when he is independent. He likes to be supported by his family, but not for a long period of time. Physical therapy focus on improving mobility, strength, and balance through exercise and other intervention. Occupational therapy helps individuals perform daily activities by addressing physical, cognitive, or environmental barriers. Speech therapy addresses communication and swallowing difficulties. Assistive devices like walkers, wheelchairs, and home modifications, ramp, grab bars, can enhance safety and accessibility. And palliative care usually provides comfort and support for individual with serious illness, and also can offer comprehensive care for those patients who are near the end of their life. What is the advanced care planning? It's considered a vital process that involves discussing end-of-life care preference and goals with patients, family, and their healthcare providers, completing advanced directives such as living wills and durable power for attorney for healthcare. Also ensure that patient wishes are respected, involves ongoing communication and collaboration among all parties involved. Healthcare providers should regularly review advanced directions with patients and update them as needed. Honoring patient autonomy and providing compassionate care, considered very essential component for advanced care planning. What is the role of the specialized geriatrician? Geriatrician usually they play a very significant and important role in healthcare because they provide their expertise in management of the complex medical condition often associated with the older adults. Their work includes coordination of care and collaboration with other specialties. Also, they focus on quality of life and functional status to help older adults maintain their independence and well-being. Also, they often address issues such as polypharmacy and how to overcome it, how to reduce the number of medications the patient take, how to avoid falls, and to deal with cognitive decline. Also, the role of primary care physician is considered significant and central in healthcare related to adults, because they deal with the management of their chronic condition and in the preventive care management for those patients. Primary care physician, they are considered the first point of contact for patients. Usually patients, they start at the primary care clinics, enabling early detection and management of geriatric syndrome. And also they coordinate care by referring patients to specialists as needed. Also, their continuous relationship with patients allow for personalized care and the promotion of overall health and well-being. What is the role of nurse expected in this, stage of geriatric patient? Nurses, they are, as all of us know, they are vital in healthcare, particularly in older adults, providing medication management, wound care, and patient education. They monitor as well vital signs and assess patient symptoms. And they offer emotional support and counseling to patients, their families. And all of us knows that about geriatric patient who love only this nurse and he wants only this, brother to take care of him, because he was bound emotionally to him because he was dealing very nice with him. Their comprehensive approach ensures holistic care, improving patient outcome and overall well-being. What is the role of pharmacists? Pharmacists usually do the medication reconciliation to check for a potential drug interaction, also to educate patient, their carer, about the proper use of the medication. Pharmacists usually collaborate and interact with healthcare providers to optimize medication regimen and improve patient outcome. Also, the expertise of the pharmacist is essential in managing complex medication regimen, especially in older adults. Social workers, they connect individuals with community service. They work with support groups, address social determinants of health. Also, they offer counseling and advocacy, helping patients navigate complex systems and cope with emotional challenges. They ensure holistic care, addressing both medical and social aspects of well-being. Physical therapists, they address physical impairment and improve overall function. They assess and treat variety of conditions. They help in developing exercise programs to enhance its strength and balance and mobility of geriatric patients. They play a key role in educating patients on fall prevention strategies, which is very important in geriatric patients. And occupational therapists, they enhance patient independence and improve his quality of life. They conduct through assessment of functional abilities and limitation to identify where areas where individual may need support and in order to have this support. Also, they offer recommendation for assistive device and home modification. Also, they provide training in activities of daily living to help geriatric patients. Psychologists and psychiatrists offer therapies like cognitive behavior therapy and supportive counseling alongside medication management when this is necessary. They also address behavioral issues related to dementia, providing comprehensive mental health support to improve a patient status. Education and empowerment of the patient considered very critical in healthcare, emphasizing that it is important for providing clear and concise information to patients, utilizing visual aids, written materials, and interactive tools. This will enhance understanding and engagement. Also encouraging patient to ask a question. Sometimes the patient, they have questions and they feel shy to ask, or they might not, they might feel afraid to ask. Enhancing those patients to ask a question and express concern. This ensure their active participation in their care plan. Effective patient education improve adherence to treatment plans and promote better health outcomes as we require. What are the strategies of communication that we're looking for? Effective communication strategies in healthcare usually involve active listening, empathy, and respect, and tailoring communication in order to meet individual needs of each patient, considered very crucial. We have to consider factors like health literacy and cognitive abilities when we want to communicate with patients, especially population who are elderly. Addressing language barriers and cultural differences ensures that all patients receive equitable and understandable care. It is very important to simplify treatment regimen in order to improve medication adherence and to reduce burden on the patient. When we reduce the number of medication and doses, this helps to streamline the treatment plan. When you use combination pills, as we mentioned at the beginning, and long-acting formulation, then we reduce the number of pills that the patient is going to take during the day, and this is, acts in the side of patient convenience. Aligning medication schedule with patient routines makes it easier, and when the patient wakes up at the morning, he can take this type of tablets, at the lunchtime, this type of tablets, at the coffee time, at the evening, this type of tablets. This helps the patient to remember his medication. Okay, involving family and caregivers very essential for this comprehensive care. We have to provide education not only for the patient, for the family or caregivers that they are tending the patient in order to have a better assistance for this patient. We have to enhance active participation in care planning and decision making to ensure the patient preference and needs are considered and covered. Address caregiver stress and burnout is also very vital, as it helps maintain the well-being of those providing care, and they can eventually take care of our elderly in a proper manner. Using technology to support adherence, this is enhanced medication adherence and overall health management. What do you mean? We mean like medication reminders and electronic pill box help patient remember his medication. Telehealth enables remote consultation, and online support groups and educational resources provide additional support also. Motivational interviewing technique is effective in fostering patient engagement and behavioral change. Also, by helping patients identify their own reasons for change, healthcare providers can tap into intrinsic motivation also. Building self-efficacy and confidence empowers patients to believe in their ability to make positive change. And supporting patients in setting and achieving goals provides a structured approach to behavior modification. Telehealth and remote monitoring are transforming healthcare access, particularly for older adults in rural areas who cannot travel and come, or who are immobile and they can't attend the clinics by themselves. Remote monitoring of vital signs, symptoms, and medication adherence enables timely intervention and personalized care. Virtual consultation support groups offer convenient access to healthcare professionals and peer support, improving overall health outcome and quality of life. What do you mean by personalized medicine? When we tailor the medicine treatment to every individual and for his unique genetic, environmental, lifestyle factors for better outcome. This approach aims to predict drug response and minimize adverse effects by considering the unique characteristic of each patient. And also it improves treatment outcome and enhance the quality of life through targeted and individualized care. artificial intelligence and machine learning, and why we are tackling this point, because now artificial intelligence is, I mean, booming science, and if we don't benefit from artificial intelligence, we might be considered illiterate. Artificial intelligence and machine learning are revolutionizing healthcare by enabling the prediction of hospitalization risk and adverse events. Technologies usually analyze patient data to guide personalized, more effective treatment decisions, and AI and machine learning help automate tasks, reduce paperwork, and give doctors more time for their patient to take care of. Policy and advocacy. By promoting supportive policies, we can ensure access to necessary resources and care. Advocating for increased funding for research and programs helps advances our understanding of geriatric care and develop innovative solutions. Raising awareness of importance of geriatric care is very essential. Now we are looking for geriatric clinics, geriatrician, specialized nurses in geriatric care, specialized pharmacy in geriatric, pharmaceutical drugs. All this is considered essential to prioritize the health and well-being of this segment of the society. In conclusion, a holistic patient-centered approach is very vital for optimizing healthcare outcomes. It is important to recap the key points discussed and provide actionable recommendations for healthcare providers, policymakers, and patients. A collective effort is needed to improve the well-being and quality for life of all type of population. And thank you. Do you have any question, or do you want to take time for a break? Can I see the chat? الجوهرة, are you around?
Yes, دكتور موجودة. Maybe we could take a break for people to pray, and then we can start the second lecture.
Okay.
10 minutes break, and then we will be back at 6:30.
Okay, fine.
Okay, thank you so much.
السلام عليكم ورحمة الله. واضح صوتي يا جماعة؟
أيوة واضح دكتورة.
طيب، بسم الله الرحمن الرحيم. هنتكلم الآن عن medication management في polypharmacy كoptimization in order to reach the proper patient outcome. ممكن نلاقي بعض التقاطع بينها وبين المحاضرة السابقة، بس هنا حتكون specifically for medication management. Okay, our objective is to recognize the knowledge and the skills that necessary in order to address polypharmacy and to understand the risk associated with multiple medication usage or polypharmacy, and to know what are the strategies that we have to follow for conducting thorough medication review in order to review the medication very properly, to understand the principles of prescribing, or reducing the number of medication, and recognize patient education techniques to promote safe and effective medication use among all types of population or patients. If you want to come for a proper definition of polypharmacy, it is the concurrent use of 5 or more medications. In some literature, you find them define it as the concurrent use of 7 or more medications. But if we want to come to geriatric perspective, they would go with 5 or more medications at one time. Prevalent, usually, or the most population who are exposed to polypharmacy, they are the older adults or the geriatrics or the elderly, as everyone likes to call them, and individuals with multiple chronic conditions. The risk associated with polypharmacy. What is the risk of polypharmacy? What's wrong if the patient is taking more than 5 or 7 medication at a time? We are expecting adverse event to happen. Potential drug-drug interaction. We know that drug-drug interaction either potentiate the effect of the medication or reduce the effect of medication or might convert it to toxic effect. Reduce medication adherence. Patients, when he see number of medication he needs to take, the whole day he keep taking, 3 tablets morning, 5 tablets noon, 11 tablets a night, and he gets sick of this and he might not become adherent. And also it's increase the healthcare cost if we didn't watch for the drug interaction, the toxic effect of the medication, or the damaged effect of the medication, that the patient will not be treated properly. The patient might need to be admitted to the hospital, and this is cost, or the patient might need to change his medication regimen while he just prescribed or dispensed bunch of medication covering a 3 month. He will throw those 3 month medication, he will dispense a new bunch of medication, and so on. But this is considered a burden or high health cost on the healthcare system. Adverse drug event, the risk of adverse drug events increase with polypharmacy. As we know, when we take one drug, okay, we know what is expected from this medication, 2 drugs, 3 drugs, but when there is polypharmacy, now we might expect adverse drug event, but we don't know from which one and which one we have to take care and how to manage. And we have to, find the solution by exclusion. Common adverse events associated with polypharmacy include falls. Some medication, like hypotensive medication, they might cause hypotension, and the patient, when he stands, there is no, balance in his blood circulation, he might fall down. Cognitive impairment, some medication might cause, delusion, deepness of sleep, cognitive impairment. And as most of the medication might cause gastrointestinal injury, erosion, and which we call gastrointestinal issues, and kidney injury, as all the medication should be, most of them, might be eliminated by the kidney, and this might cause, kidney injury. Drug interaction, we are concerned about 2 types of interaction: pharmacokinetic interactions, pharmacodynamic interaction. And let us give some examples in order to make the picture very clear. Warfarin and non-steroidal anti-inflammatories, we know that when those medications are taken together, There is an increased risk of bleeding with warfarin. Statins and macrolide antibiotic, they may elevate the risk of myopathy, that the patient feels there is a pain in the muscles and sometimes he is unable to move or to mobile. Digoxin and diuretics, this might lead to accumulation of digoxin in the body and leads to digoxin toxicity. And for reduced medication adherence, complex medication regimen can lead to confusion and non-adherence. Factors contributing to this, with the many number of medication, patient might forget. He might think that he took the medication of morning or the medication of afternoon, and he might forget the punch, which is to be taken at evening. Cost of the medication, sometimes when the when there are many products to be taken as medication, this means cost. And sometimes patient doesn't have the amount of money to buy his medication. He might start taking the tablet, which is to be taken 2 times daily. He might take it once daily or every other day. In order, they would say in نص العمى ولا العمى كله, in order to reserve some medicine in his body, thinking that he's capturing the stick from the middle, while this is wrong, because if the medication didn't reach steady state or the therapeutic level required in the body, it might not give its effect and might cause resistance even. And side effect, that patients might be exposed to side effect without explaining for him. This side effects means that the medication is working or you are doing wrong practice in your life. And maybe once he sees the side effect, he'll stop. For example, patients who are taking metformin, when they take metformin, they start having gases and distension of the abdomen. And when they come to complain for the side effect, and that's why we stop the medication, we directly explain for them that the metformin prevents the absorption of carbohydrates. And when you have it like this, significant feeling, that's mean you are taking amount of carbohydrate more than the recommended ones, and that's why the side effects happen. And by this we can measure how adherent you are to the guide or to the advice of the nutritionist at your institution. Reduced medication adherence, we need in order to improve medication adherence, that we have to simplify the regimen. We have to use pill organizers in order to divide it for the patient, which tablets to be taken morning, evening, at midday, and to be labeled of those organizers, providing reminders for every time group of medication, and addressing patient concerns. If he has any concern about the medication, it makes it like urine discoloration, it can increase my constipation status. All these things should be addressed in order to overcome it and to tailor it to the patient preference. Increased healthcare costs are a significant concern associated with polypharmacy. Definitely, as we mentioned before, the economic burden is due to medication cost or hospitalization. But as we said, that when the patient having like drug interaction, he's not aware or is not counseled about, or adverse effect, this might lead to hospitalization. This is another burden. And increased emergency room visits when as we mentioned before hospitalization, there is a visit to the emergency room. Also, geriatric syndrome, polypharmacy can contribute to the development of geriatric syndrome, which include, as we mentioned, falls when he's taking hypotensive medications, or sometimes when he's taking some alpha blockers for prostate enlargement. This might cause also falls. The patient might suffer of weakness as a result of taking a certain type of medication, cognitive impairment, and urinary incontinence, as we mentioned, specifically when they are taking diuretics. The impact on their quality of life, definitely polypharmacy can negatively impact quality of life, because as we mentioned, due to the side effects, patients when he taking, certain non-steroidal anti-inflammatory, he start to have gastric upsetness and increase acidity, and he is not feeling well, and he doesn't want to sleep because this regurg will happen, and he delay his sleep. He wake up next day feeling lazy and tired and weak, and he might be late for his work All these is, vision cycle, functional decline and reduce independence. What do you mean by functional decline? This is loss of physical or cognitive abilities that make it difficult for all patients to perform everyday activity. And also it can include difficulties in mobility, such as walking or climbing chairs. Difficulty in mobility makes the patient tied to bed, and he might start having like DVTs or bed sores or any other, consequences. The prescribing cascade, what do you mean by prescribing cascade? Prescribing cascade happens when a new medication is prescribed to treat side effect of another medication. And be sure that usually the side effect of one medication is not treated properly by the other medication. And that's why you have to start treating the root. If there's medication causing side effect, try to find another medication without these side effects. And to avoid this, it's important to carefully consider whether new symptoms are side effects of existing medication before prescribing an additional one. Regularly reviewing patient medication list and considering the prescribing when appropriate can help significantly in preventing this cascade. Comprehensive medication history. What do you mean by this? We have to obtain a complete and accurate medication history, including his medication, over-the-counter drugs, prescription medication, over-the-counter medication, supplements, vitamins, herbal remedies. All these things should be collectively, gathered in order to be able to judge for which medication he has to go on. We usually do not depend on single source. We don't depend on the patient alone because he might forget, he might not remember. So that's why we have to go to patient interviews, patient list, pharmacy records, medical charts, and employee effective technique to collect medication information from patients and caregivers. I remember one of the techniques, we had a patient who was admitted for increase in his INR. And when we checked all his medication, there were no drug-drug interaction, and his INR is keeping elevated. And one of the techniques that we noticed that the patient is keeping a type of bottle next to his, under his pillow. And when they wanted to do a change in bed sheets, he used to grab this bottle and keep it at his head. And then I was asking him, what is this uncle? Yani he was a geriatric one. And this is one of the herb. I bring it from the, asir. And it is very good one for maintaining my health. And I said, can I just see it? I said, no, you, the healthcare providers, you don't believe in those herbal remedies. I told him, I am a herbalist. Originally, my specialty is pharmacognosy, and I do believe in herbs, and all medication comes from herbs, but we have to extract in proper way, to have it weighed, to have it cleaned. I tried my best to convince him to give me this type of herb. And when we sent it for analysis, we discovered that it is the source of this increment in the INR. So that's why you have to find a technique in order to find why this drug interaction happens if you cannot find it among among the medication list that the patient is taking. Indications and efficacy. When reviewing medications, it's important to confirm that each medication is still necessary and effective for its indicated purpose. Considering non-pharmacological alternative where appropriate can also help reduce the number of medication the patient is taking. For example, one of the patients usually they said, I have every day before I sleep, I have to take one anxiolytic tablet in order to fall asleep. And when we checked his lifestyle, we found that he just asleep during the early noon. He's still sleeping until 1 p.m. and then he wake up. And when he find the whole family is going to sleep, he wants to sleep and he could not. When we may arranged his sleeping time, he could sleep without taking those sleeping aid pills. Drug interaction and adverse effects, systematically screening for potential drug interaction and adverse effects, considered very crucial, and this can be done using a drug interaction database. As healthcare providers, we know that there is in Micromedex or Lix Europe today, there is a drug interaction database that we can figure out if what type of drug interaction, how severe is it, and how can we avoid or mitigate this drug interaction. Duplication and omission, identifying duplicate medication and unnecessary combination, important step in medication review. Yani sometimes when we review the patient medication, he has like 2 analgesics. He has like 2 PPIs. And when we ask them, they said, I use this one. If it doesn't work, I go to another one. But they are both non-steroidal anti-inflammatory. Either to use, it was, Profen and Arcoxia that time, I remember. You can't take the two medication at one time, either one of them. And he said, yes, the physician told me this. And do you practice taking all of them in different occasions? He said, no, when I take Profen, after 2 hours, if I didn't feel relieved, I'll take the Arcoxia, which is wrong. And that's why you should not keep all those at the patient, especially as when he is a geriatric, because he thinks by experience he's, dealing or treating his case. Patient factors and preference. When reviewing medication, it's important to consider patient-specific factors like his age, the patient age, comorbidities, what other comorbidities that should be considered with his case, renal and his hepatic function. Some medication should be adjusted, the dose should be adjusted if the patient have renal insult, and some of them should be avoided if the patient have any hepatic insults. Cognitive status, if the patient his cognitive status is affected, we should not give any medication that will exacerbate the situation. Also, medication that can affect his functional abilities. Prioritizing medication for review and potential deprescribing usually is based on risk-benefit ratio and patient-specific factor. Usually, we focus on high risk of adverse drug events. Medication who has high risk to cause adverse drug events, we might consider deprescribing this medication. Medication who has high potential drug interaction, we can find alternative which is safer, we would go with this. And medication with limited benefit, like usually when patients, they go to the physician, they would request prescribing bunch of or low value medication that is not necessary for their health status, and they might get it. Documentation, we consider it very essential to document the medication review process thoroughly in order, for all healthcare providers to have a look over. You can document the findings that you find, your recommendation, rationale of the prescribing of certain medication, make it clear for the following healthcare provider to find it. Collaboratively setting medication management goal with all patient related group, with the patient, with his family, with his physicians. This will be ensuring that the goals align with the patient preference and values, and this is definitely essential in order to ensure that the patient is adherent to the medication prescribed for him. If we want to talk about deep prescribing, and we talked about it, it's a process of safely and carefully reducing the number of medication, and definitely we will reduce the unnecessary medication. Never think to delist the necessary medication for the patient life. And when you do the deep prescribing for some medication, you need to gradually reduce the dose. You can't reduce the dose or reduce the medication abruptly or stop it abruptly. Medication for deep prescribing, they should be identified depending on very clear criteria and guidelines, such for is this medication indicated for this case? Is it efficacious? Yes, the evidence-based medicine and the studies supporting this effectiveness of this medication. The adverse effects of this medication, is it the lowest adverse effect in this therapeutic group? Does the patient prefer injection or tablets or long-acting insulins or short-acting insulins or products to be given once weekly, once every 6 months? And what is the prognosis expected after, adhering to this medication? For deep prescribing, it's important to create a plan and to be step by step for gradual reducing or stopping medication, because if we don't do this, maybe the patient will experience withdrawal effects and he might return back to the medications in even higher doses. And we have noticed that so many times with patients who used to take SSRIs, when they abruptly stop the SSRIs, they said, we feel like that we have electrical signals, we have like imbalance, and they come back again to that dose. And they have the feeling that since they stopped the medication for a couple of days, then it's not effective in its regular dose, they have to double the dose. All these things should be considered, and a proper plan should be, put for this situation. As we mentioned, the gradual dose reduction is important to avoid withdrawal symptoms. For monitoring and follow-up, monitoring patient closely for withdrawal symptoms, rebound phenomena, and any change in their condition considered very essential. And you have to be with the patient hand by hand until you are sure that he reached to balanced status without any obstacles. He has to receive ongoing support and education for every stage of his life after he stopped this medication gradually. Patient concern and fear about deep prescribing should be addressed and should be discussed, and patient should be assured in order to be sure that the patient will go with your plan without any anxiety and with ease. Documenting the deep prescribing versus this is very important, because sometimes lacking documentation, the patient might visit the physician, and when he looks at his chart, he has no information about this medication has been prescribed, and he might re-prescribe the medication again for the patient. Then we go again in the same dilemma. Specific medications classes to consider. Usually we are caring about benzodiazepines, which the patient used to receive for anxiety or insomnia. But as we know, long-term use of these medications might lead to habituation or dependence, might cause cognitive impairment, and definitely risk of falls. Also, opioids usually are given for sensitive type of medication who have like sickle cell anemias, who have cancers. They give it for pain management. And, all of us know that it carry the risk of addiction, respiratory depression, and other adverse effects, specifically when used for a long term of use. Anticholinergics, these medications have significant side effects, especially in older adults, and sometimes they give it for diabetic patients in order to improve their neuropathy, for like amitriptyline, which has like anticholinergic effects, but it includes cognitive impairment. And this should be, discussed with the patient. If these symptoms happen, then the patient should revisit the physician in order to find a proper alternative. Proton pump inhibitors, while effective for reducing stomach acid, we know that long-term use of this medication can increase risk of infection and nutrition deficiency. What is the importance of educating the patient about their medication? It is important to improve the adherence when they understand the importance of this medication, why it's all prescribed for him. Dose medication has been reviewed properly, a drug interaction has been addressed, adverse effect has been addressed, then everything is clear for the patient, and he can adhere to his medication knowing the importance and the benefit that will be to his health if he adheres to this medication. What medication knowledge that the patient has to know? He has to know the medication name, the dose, the indication, and the potential side effects for this medication, how to overcome these side effects, at what stage he had to document and to inform his physician. What are the adherence strategies? Usually teaching patient the strategies for improving medication adherence is considered very essential, specifically when we want to de-prescribe a medicine or if we want to manage multiple medication. Using pill organizers, tell them that what's the advantage of this pill organizer, what's the advantage of reminder tools, and the medication diaries. Those all can enhance adherence, and patient can use them properly if we inform him or share the decision with him. What are the self-monitoring technique? Empowering patient to monitor side effect and the changes in condition is vital part of his education. And we have to provide him with clear guidance on when to seek medical attention, not to keep on calling medical attention for every minimal and non-significant change, and to ensure patient that he feels supported by this healthcare provider who will not get annoyed from frequent, non-necessary calls. We have to educate him exactly when to call this, medical or healthcare provider. Communication techniques, the best thing is to listen actively to the patient, to let him feel that you are empathetic with him, and open-ended questions to ensure that the patient concerns have been addressed, his preference has been known, and this, we are sure this will improve patient and will provide a relationship. He feels that he cares about him, he listens to me. And so many times we find patients, they come and ask about healthcare provider by his name because he feels comfortable with him. And we will dig deeply to know what this healthcare provider does. Only he listens actively to him. He shows him that he is very empathetic to him. He open with him, open-ended questions, meeting with him, on scheduled occasions. All these things should be considered. Involving caregivers, the education process is very important because we know that the patient myself, might have cognitive impairment, might not be alerted all the time. The caregiver should be aware of everything related to the patient. We have to provide them with necessary tools and resources, and caregiver, as we know, they effectively support patient in understanding the advantage of their medication, why they delisted this medication for him, why this side effect has happened, how to manage this side effect, and to improve his adherence to the medication. Okay, what do we mean by when we say shared decision support or shared decision making? That means the decision between the patient, healthcare provider, patient carer, all these should be shared. Let us take an example to on this shared decision making. One scenario, Mariam, she is 55-year-old patient, has been diagnosed with hypertension. The traditional approach, what is a traditional approach? Doctor might prescribe standard first-line medication without much discussion. Shared decision, the doctor explains the different classes of antihypertensive medication available. He was discussing with the patient, such as ACE inhibitor, beta blockers, and diuretics. They discuss the potential benefit and side effect of each class. Mariam expresses concern about side effects like fatigue, common with beta blockers. Then, when Mariam says all the time, I feel fatigue, then we will avoid beta blockers, and prefers a medication with once daily dosing. Therefore, the doctor decided to give her ACE inhibitor, considering Mariam's preference and doctor clinical judgment. Clear? Okay. Also, with patient with osteoporosis, an older adult, Nasser, experienced knee pain due to osteoarthritis. What is the traditional approach? The doctor might immediately suggest pain medication or refer to orthopedist for surgery. Shared decision, the doctor discussed various treatment options, including physical therapy, weight management, and pain medication, oral and topical, injection, and surgery. Nasser expressed his wish to avoid surgery if possible and prefers to start with non-invasive treatment. They agree on a plan that includes physical therapy, weight loss strategy, and topical pain relief, with regular follow-up to assess progress and adjust plan if needed. This is the meaning of shared decision. Yani the patient is shared in the plan. Also, on one case on type 2 diabetes, Fatima is newly diagnosed with type 2 diabetes, and a traditional approach, the doctor might prescribe standard medication like metformin to provide basic dietary advice. At shared decision making, the doctor explains the importance of lifestyle change like diet, exercise, and discuss different medication options, including their difficulty with strict diet and her preference for medication that can help with weight management. They decide on a plan that includes diabetes education program, dietary modification that align with Fatima's preference, and medication like GLP-1 receptor agonist, which can reduce weight and control diabetes. What are resources that we can provide patients in order to know? Usually, there is now National Institute of Health offers wealth information, various health topics. في National Library of Medicine, Centers for Disease Control and Prevention, and also professional organizations like American Academy of Family Physician. We have in our country Arabic, institutions, but I could not gather them that quickly. For all the adult, discussing the unique challenges of medication management in older patients is considered very essential to optimize their care, and any changes related to their age in the pharmacokinetic pharmacodynamic along with comorbidities should be carefully considered. Like those patients, they have like kidney problem, they have any drug-drug interaction, all these things also should be considered. We'll talk about, an example with Mrs. Badriya, who is 82-year-old woman, visited her primary care physician for routine checkup, and she has a history of hypertension, osteoarthritis, mild cognitive impairment, and she's currently taking 4 medications. She's taking amlodipine for hypertension, ibuprofen for osteoarthritis as pain reliever, which is non-steroidal, aspirin for cardiovascular protection, and sleeping aid medication. Pharmacokinetic pharmacodynamic, the physician considers that due to Badriya age, her kidney and liver function may be reduced, and this is expected at this age. This means the medication may stay in her system longer, increasing the risk of side effects. The doctor also knows that older adults can be more sensitive to certain medication due to changes in receptor sensitivity. So, Badriya, hypertension, and osteoarthritis need to be managed, but the physician is also aware that using ibuprofen long-term can worsen her blood pressure. طبعا non-steroidal for a long period of time can exacerbate hypertension and potentially affect her kidney. Cognitive impairment, Badriya mild cognitive impairment means she may have difficulty in remembering to take her medication correctly. She may also struggle to understand complex instruction or manage multiple medication at different times. The physician conducts a comprehensive geriatric assessment evaluating Badriya cognitive function, nutrition status, social support. Medication review, the physician reviews all Badriya medication, considering the potential of drug interaction and side effects. She learned that Badriya has been taking ibuprofen more frequently due to increased knee pain. The sleeping aid also leaves her feeling unsteady in the morning, increasing her risk of falls. For de-prescribing which medication they have to delist it, the physician discussed the possibility of de-prescribing the sleeping aid as it might be contributing to Badriya cognitive impairment and fall risk. They explore alternative strategy for improving sleep hygiene. Alternative and adjustment, instead of ibuprofen, the doctor suggests topical pain relievers or acetaminophen في البدرية osteoarthritis pain to minimize the risk of kidney problem and hypertension exacerbation. They also discuss physical therapy option. The doctor simplifies بدرية medication schedule by consolidating some medication and using a pill organizer to improve adherence. And patient care and caregiver involvement. The physician involved بدرية daughter who often helps her mother in the care and in her medication management. The daughter can assist with medication reminder and monitoring for her side effect. The physician provides a clear, simple instruction for taking the medication and explains the importance of each one. She also educates Badriya and her daughter about potential side effects to watch out for. For follow-up, the physician schedule a follow-up appointment to monitor Badriya's response to the change in her medication regimen and to address any concern. What outcome we gain? By carefully considering Badriya's age-related change, comorbidities, and cognitive impairment, the physician creates an individualized medication management plan that optimizes her health, reduce the risk of adverse effects, and improve her quality of life. The plan emphasizes non-pharmacological approach when possible and involves both Badriya and her daughter in the decision-making process. And this is what they mean by, decision shared process. Patients with cognitive impairment, when managing medication for such type of patient, simplified regimen is considered very important. This can involve reducing the number of medication and use combination pills if this is appropriate, and involve the caregivers and involve assistive devices, as we mentioned. Patients with renal or hepatic impairment, we need to adjust the dose based on their renal or hepatic function to prevent adverse effect or deterioration of the status. And we have to avoid nephrotoxic or hepatotoxic medication as well. What we have to call for action. We have to encourage healthcare providers to prioritize medication management and polypharmacy in their clinical practice and consider an important step toward improving patient outcome. Advocating for policies that support medication optimization and reduce the burden of polypharmacy also can create a health care environment that promotes safer and more effective medication use. Thank you. Geriatric population in Saudi Arabia, they are not under-medicated nor over-medicated, but now there are, a passion among all health sectors to adjust the medication for the patient need, tailor it to be individualized for patient needs and patient status. So before, the patient used to take medication from several institutions. That's why he might have duplicate treatment. Now it is tailored that the patient has to take his medication from dedicated organization in order not to have duplicated. And they are, as mentioned, adequately medicated. No, how to help a patient who has heart failure? Take, I don't know, it's not clear the message. You're welcome. Usually, you need to adjust the dose for him for his incontinence. I mean, they usually weigh benefits against the risk. Heart failure is more serious than incontinence, and depends on the age of the patient. They might put him in a diaper. They might, if he's hospitalized, he might be on catheter specifically for the critical, phase of his disease. Or to put him, if he's at home, to be very close to the toilet, or to put, the movable urine tool in order to collect the urine for him. But to stop, the diuretics in order to reduce the incontinence, this is not proper weighing of benefits against risk. I've never come across such AI tool, but there is a database or decision support system and application, but it's by subscribing in order to consult them against certain medications. Is there any, drug interaction expected for this patient? And usually among hospitals, it's linked to the patient medical record and can give you the answer in an individualized manner. Okay, if there is no further question, I think we reached to the end. I don't know. Yes, I think we're done. I don't expect that there is another presentation after mine. Maybe tomorrow you will have the second session. So I think if there is no other question, we can close here.
الله يعطيك العافية دكتورة، ما قصرتي. Thank you so much.
الله يعافيك.
And
Thank you,
yes, we are going to conclude for this today, and we will see you tomorrow إن شاء الله بإذن الله.
إن شاء الله. السلام عليكم.